Hello, students. So this is chapter 7, and I will go through this first video and just read the first reading. As you can see, it's also on CD2, track 1. Matters of life and death. Matters here, synonym for matters is issues. Issues of life and death. And I'll close this. In a new book, A Miracle and a Privilege, Dr. Frances Moore, 81, of Harvard Medical School, discusses a lifetime of grappling with the issue of when to help a patient die. So grappling with the issue here means wrestling with the issue, fighting with the issue. So it's when doctors question themselves of what's the right thing to do. When you grapple with something, you think about the pros and the cons of a thing. So it's like a mental wrestle. Mental fight. Doctors of our generation are not newcomers to this question. Going back to my internship days, and internship is when before you're a doctor you have to work in a hospital being watched by doctors. And going back to my internship days, I can remember when many patients in pain, sometimes in a coma or delirious with late hopeless cancer. For many of them, we wrote an order for heavy medication, morphine, by the clock. And morphine means, we look at the footnote here, morphine is a powerful narcotic or a powerful drug. It can cause death in large doses, can cause death in large amounts. This was not talked about openly and little was written about it. It was essential, not controversial. The best way to bring the problem into focus is to describe two patients whom I cared for. The first, formerly a nurse, had sustained a fractured pelvis in an automobile accident. Your pelvis is your hips. A few days later, her lungs seemed to fill up, her urine stopped, her heart developed dangerous rhythm disturbances. So there she was, in a coma, on dialysis. I'm not sure what dialysis is. We'd have to look it up. Let's look up dialysis. Use our online dictionary. Dialysis definition. The clinical purification of blood by dialysis as a substitute for normal function of the kidney. So when a machine does what your kidney should do. On a breathing machine, her heartbeat maintained with an electrical device. One day after rounds are what a doctor does. He walks around the hospital talking to patients and looking at patients, and those are called rounds. One day after rounds, my secretary said the husband and son of a patient wanted to see me. They told me their wife and mother was obviously going to die. She was a nurse and had told her family that she never wanted this kind of terrible death, being maintained by machines. I told them that while I respected their view, there was nothing intrinsically lethal about her situation. So intrinsically means that there's nothing, there's no part of her situation that's lethal, no definite part. So when something is intrinsic, you can't separate them. So that her situation was bad, but not deadly, not lethal. The kidney fail she had was just the kind for which the artificial kidney was most effective. While possibly a bit reassured, they were disappointed. Here was the head surgeon, seemingly determined to keep everybody alive, no matter what. When patients start to get sick, they often seem to fall apart all at once. The reverse is also true. Within a few days, the patient's pacemaker could be removed and she awoke from her coma. After about 6 months later, I was again in my office. The door opened and in walked a gloriously fit woman. Fit means healthy, athletic and healthy. Oops. After some cheery words of appreciation, The father and son asked to speak to me alone. As soon as the door closed, both men became quite tearful, meaning they cried. All that came out was, "We want you to know how wrong we were." Sorry about how this picture turned out. The second patient was an 85-year-old lady whose hair caught on fire while she was smoking. She arrived with a deep burn. I knew it would surely be fatal. Fatal means deadly. So, or like we saw before, lethal. As a remarkable coincidence, there was a seminar going on at the time in medical ethics, given by the wife of an official of our university. She asked me if I had any sort of ethical problem I could bring up for discussion. I described the case and asked the students their opinion. After the discussion, I made a remark that was, in retrospect. Retrospect is hindsight, or if we look at this, spect is vision, retro means before. So let me do this. Retro means before, spect means vision. So a synonym is hindsight. It's when after a situation is finished, you look back and say, oh yeah, I could have done that different. So in retrospect or in hindsight, I would have done that differently. In retrospect, a serious mistake. I said, I'll take the word back to the nurses about her and we will talk about it some more before we decide. The instructor and the students were shocked. You mean this is a real patient? The teacher of ethics was not accustomed to being challenged by reality. In any event, I went back and met with the nurses. A day or two later, when she was making no progress, she was suffering terribly, we began to back off on treatment. When she complained of pain, we gave her plenty of morphine, a great plenty. Soon she died quietly and not in pain. As a reasonable physician, you had better move ahead and do what you would want done for you, and don't discuss it with the world first. There is a lesson here for everybody. Assisting people to leave this life requires strong judgment and long experience to avoid its misuse. Okay, the next video, I will annotate this reading. See you there.